Hi, it's Tom from Running Physio here. Today I'm going to talk to you about patellofemoral pain, often what runners will call runner's knee. Now from the start I should point out that some people, when they talk about runner's knee, because it's a generic term, they refer to iliotibial band syndrome. But today we're going to be focusing mainly on patellofemoral pain and 4 key strategies for its management. Don't forget to, we've got a great selection of free videos for you over at clinicaledge.co/running. So check those out, some great webinar series there that you can enjoy. So runner's knee, patellofemoral pain, it is one of the most common injuries we tend to see in runners, and it can be challenging to address. But actually, I think the treatment strategies that can be quite simple if they're applied well can be very effective. And I actually really enjoy working with runners with this particular condition because I often think there's lots we can offer them to help get them back to their running and gradually build up. So let's talk about these key treatment strategies. The first one, and one of the most important, is to try and improve the runner's understanding of what patellofemoral pain actually is. Now this is really important because when you talk to runners and other athletes, you often find they've got lots of concerns and fears and worries about their pain and what it means. So a good starting point is to find out what it means to them. Ask them, what do you feel is actually going on in your knee? How would you describe your knee to me? What do you think is causing your pain? Because it's very difficult to help improve their understanding and reframe their pain unless we can start by finding out what they believe is going on. Now, runners will sometimes believe that their kneecap's out of alignment, that it's maltracking, that it's being damaged in some way or another. And that's often a really important starting point to make and say, well, this isn't about damage. It isn't about something being out of place. It's usually that joint between the kneecap and the femur has been overworked and has become irritated and sensitive. And those are the terms I prefer to use. They're quite neutral, they're quite easy for people to understand. Personally, I'm not a big fan of mechanical terms like malalignment, maltracking, etc. Because once you place that phrase in someone's head, it's quite difficult for them to get away from it. And it's hard for them to have a positive perception of return to running or whatever their sport is if they think there's something physically wrong with their knee and it's not moving as it should. So first point, help improve their understanding, help them see that the pain doesn't mean damage, but help them see too that the amount of activity and type of activity they do is quite important and that there is a balancing act. We don't want them to stop all activity. That's not helpful. But if they keep going at a level of activity, particularly with their running, that is continually irritating the knee, it is very difficult to calm it down. We've got to think outside of running too, because there are lots of other activities that can irritate things. So number 1, we improve their understanding, and number 2, which is very much linked to this, of course, we bring in load management and activity modification. If we can do this, even just education, improving understanding and load management can be effective in reducing pain in runners with patellofemoral pain. Now, one of my friends that I follow on social media shares a lot of great stuff, David Poulter. He has this excellent phrase, which is listen to your patients. They'll tell you the answers. And I'm a big believer in this. With both the education and understanding, but also the load management, we've really got to listen to people and find out what things affect their pain. So find out with their running, what is it that seems to aggravate it? Is it longer runs? Is it faster runs? Is it hills, maybe going downhill because it has higher patellofemoral load? Alongside finding out about their beliefs, that gives you the starting point for your load management, but it also helps you identify what is manageable. So how far can you run with minimal pain at the minute? What sort of speeds and sort of sessions are tolerable for you? Which are too provocative? Because then we can start to fine-tune their training around stuff that they can manage. Also, an important thing to find out is, where do you want to be with this? What's your goal? What are you heading towards? Because part of load management has got to be a graded return towards that level of running, and that's really important too. We've got to find a good starting point that's manageable and gradually progress towards whatever their end goal is. Now, we can offer some guidance in terms of pain with this. Like several other running injuries, generally what we're looking for is minimal pain, sort of up to mild pain during running. so perhaps up to a 3 or 4 out of 10 during running, that settles quickly afterwards, so it's back to baseline within about 24 hours. And that seems to work quite well because it gives them a little bit of structure, a little bit of guidance in terms of what pain is expected and acceptable. Now, I would argue that these two things are key in running injury, and there is some evidence to support this. J.F. Esculia, who's a fantastic researcher, did this really great randomized clinical trial in 2017. It was published in the British Journal of Sports Medicine. And what they did is they took a group of 69 runners with patellofemoral pain, and they randomized these runners into one of 3 different 8-week rehab programs. Now, Group 1 had just education and load management, very much in line with what we're talking about, finding a manageable level of running that doesn't cause a lasting increase in symptoms and progressing from there. Group 2 had the same education and load management, but they also had gait retraining, mainly focusing on a 10% increase in step rate. And Group 3 also had education and load management, but they had exercises to try and improve the strength and load capacity in the limb, I think particularly around things like strengthening up the quads and also the glutes. Now, what's interesting in this study is all 3 of these groups improved, but there were no significant differences in symptoms or function between the groups. So it would appear that it's the education on the symptoms and management of training loads that should be seen as one of the key treatment strategies for runners with patellofemoral pain. And adding gait retraining and adding strength work in this particular study didn't seem to improve results. Now, I wouldn't say then that that means we're not going to do strength work, or we're not going to do gait retraining. Part of the issue with the study of this design is that we randomize people into groups. So it'd be really interesting to see if the treatment was more based on subcategories or patient needs, with those with particular gait factors that may need to be addressed, having some gait retraining, and those with weakness in key muscles having more strength work. So I still think there is more of a role for those other areas too. Which brings us to point number 3 in managing patellofemoral pain in runners. Improving strength and control, I believe, is very helpful. And I would tend to work on 3 main muscle groups that work together to manage load during the running gait cycle. And that would be the quads, the glutes, and also the calf muscles. And actually there's now more and more evidence showing this, that strengthening up the quads or the glutes can be effective in patellofemoral pain, and we now have more evidence showing that if we strengthen at the level of the foot, that may help too. And when you think about how we manage load during running, it's actually the calf complex, particularly the soleus, that does the bulk of the work, managing about 6 to 8 times body weight in peak load. So having a strong calf complex should, in theory, help us manage load through the knee. I'd often combine that with control work too. And again, we can be guided by the patient. What activities of daily living provoke pain? And let's have a look at those activities. Let's see how you're doing them. Are you moving in a way that puts more stress on this knee? For example, going up and down stairs, which is commonly painful in patellofemoral pain. And can we find a way of subtly changing your movement to make it a bit more comfortable? Now, this isn't about demonizing how someone moves, but just saying we could find a way of making this more comfortable for you. It's not about good or bad movement, but maybe improving control in specific tasks that they find challenging to see if that leads to an improvement in symptoms. And it may have a knock-on effect in affecting the forces in running, altering the kinetic side of the running gait cycle. So 3 things so far. We've got improving understanding, load management, and incorporating strength and control. And our 4th option here, which we can add in, and I would see this as maybe our 4th priority down the list, would be gait analysis and retraining. Now, I think we've got to get those other strategies in there first. We might focus on things like recovery and sleep as well, and bring the gait retraining in later once we've got those key strategies in there, because it is fair to say there's more evidence for our education and load management for our exercise prescription than there would be for gait retraining. Now, we talk about this quite a lot, of course, in Module 3 of Running Repairs Online. And researching for this recently, I came across a great new paper from Chris Brammer and colleagues. Now, what they did in this study is they recruited 18 runners with patellofemoral pain, and they did a 3D running gait analysis to identify which ones may benefit from gait retraining. And I like this because this is very much in line with what we would do in clinic. It's not a question of throwing the intervention at everyone and just hoping it sticks. It's more about finding out who might actually benefit from it. So they found 12 people out of this 18 that had increased hip adduction and contralateral pelvic drop, which are believed to be factors that might increase the stress on the patellofemoral joint. They provided just a single session of gait retraining, and they were advised to increase their step rate by about 10% using a metronome, so run to the beat of the metronome. Then during their runs, they monitored their step rate using their GPS watch and tried to again maintain that higher step rate using the metronome. And there are significant improvements in pain and function at 4 weeks that were then maintained at the 3-month follow-up. And if you look at the graph on the right-hand side of the screen here, which is looking at worst pain experience, it's really quite a nice shift from baseline down to 4 weeks and 3 months. They found that the runners were successfully able to increase their step rate just from this single session with the ongoing feedback from their GPS watch. And they also had significant reductions in hip adduction, pelvic drop, and peak knee flexion, which is another thing which can increase patellofemoral joint stress. Now, for me, what I also find really interesting about this study is that all runners reported an increase in their weekly running volume and longest distance run pain-free. And I love that. I think that's a really positive finding in this study, because this is what it's about for our runners. Can we actually use a strategy which reduces their pain and allows them to run more? And we often use that idea of running tolerance, how far can you run pain-free, as a nice outcome measure that we can use with runners to see how they're progressing, because it's important to them. So of course, it's important to me as well. So just to recap then, those 4 key points: improve the patient's understanding, help to reframe their pain in a more positive way, and address their worries and concerns about their knee. Look at load management and activity modification to bring the running down to a manageable level and then gradually progress. And include some strength and conditioning based on their needs, which may well include strengthening the quads, glutes and calf, and possibly improving control with single leg tasks as well. And then finally, we might consider some gait retraining in there as well, but that's going to be very much based on individual assessment. So we've got to assess them first. Are they tending to overstride with a low step rate, which we think will place more stress on the knee? Have they got an increase in hip adduction during loading, which may place more stress on the patellofemoral joint? If those things are there, then we can address them. But it isn't just a question of pushing everyone's step rate up by 10% or aiming everyone to an arbitrary number like the very popular 180 steps per minute. So all of this, of course, is very much got to be based on individual needs and adjusting your treatment accordingly. Okay, so that's a whistle-stop tour of patellofemoral pain in runners. I hope that gives you lots of ideas. I look forward to reading your comments and questions later. I always try and get to those after these videos. And don't forget, we've got that great selection of free videos. We put the link in the title here and also in our Instagram bio. So check those free videos out, and I look forward to speaking to you next time.